There we go. Call to order the Health and Human Services meeting, December 18th, 2024, 5 p.m. Roll call.
Sean Anderson is excused. Mike Barkalow.
Present.
Kathleen Findley.
Present.
Kathy Leaf.
Present.
Lisa Lind.
Present.
Deb Lindeman.
Present.
Dave Osnes is excused. Julie Smith.
Present.
And Greg Telejohn is excused.
Okay, we have quorum. Approval of the minutes. Motion to approve.
I move to approve the minutes as printed. I second.
All right. Vote. Yeah. All those in favor say aye.
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 Yep. Can we go back to the agenda there? Or do we have the agenda anywhere near?
Just public comment. Just on
Oh, yeah.
public comment.
Do it. There we go. Thank you. Time for public comment. Anyone here for a public comment? Going once, going twice, and forever hold your peace. Okay. Moving on to business. Financial report for November 2024. Bob, is that you're going to take that on? Or
Oh, I'll do it.
okay, very good. Sorry.
That's all right. Okay. The financials are, oops, let's go. Okay, so the financials in your packet are through November of 2024. Just doing a quick glance when we look at where we are this year in revenues compared to last year at this time in revenues. We're very, very close to the same amount. Overall, our total expenditures are also very close to the same amount, so we're kind of tracking the same as we were last year at the same time.
Last year wasn't great, though.
I have good news to share, though.
Oh, all right.
So, public health. When we look at our state grant right now, it showed that we've virtually received all of it, but we did get an additional $89,935 in WIC funds that will still be coming in. We received an additional $85,900 in COVID immunization funds from apparently other counties that didn't spend all of theirs. And there was an extension made that will extend that money through June of next year. So we have until that time to spend it. And then our ARPA recovery funds, we had $30,000 that was, we hadn't fully spent yet. And we received an extension on that as well till June of next year. So that's good news for public health. In behavioral health, you'll notice on this judgments and damages line, there's 972,241. So that's our opioid settlement money. When that money comes in, it has to be recorded as revenue in the year that it's received. That will go against our fund balance more or less. In future years, as we get more additional revenue in, that will support the expenses that we have. We have the 2 opioid settlement positions. And then if we don't have enough revenue coming in to cover those, we'll use fund balance then for the difference. CCS, so we received our cost settlement. We have $2,105,000 that came in as part of our 2023 cost settlement. We still have 3 months left of revenue to collect from here, so we're pretty much on track for our revenue for CCS. And then in ADRC, we received another $126,000 in general program revenue. So they had some emergency funds that they were able to get approved. So that's going against our ADRC. And then on the nutrition program, again, some counties did not fully spend their ARPA nutrition money, so that was reallocated to us. We got an additional $25,996 there. And then Kristen also just got a new grant approved for $25,000 for marketing and outreach. It's one of these ones apparently started last September, ends in February, but she has plans to use that money. Oh, so just, we had $525,000 budgeted for our Wimker cost settlement. That should be here in December. I haven't seen the numbers yet, but we are fully expecting to receive that revenue as well. Healthcare campus. Our revenues, so again, the nursing home is doing really good this year. The Medicaid rates that are now fully supporting our costs are helping them to be on track. We're like $1,600,000 ahead of where we were last year at the same time. When you look at our balance right now, it's showing $1 million positive. We have not fully expensed all of our depreciation yet, so we'll now have another $460,000 in depreciation that gets recorded. But that'll still, you know, if trends continue as is, we'll have, you know, finish with $500,000 to the good in the nursing home. There's an update coming on Kitty Roads later, but you'll see and hear that we do have a lot of expenses now showing, and that's the items we're purchasing for the dementia care unit. We do have state funding that will cover that, so again, it's about 2 months behind when I submit the claims to when we get that revenue. That revenue will be posted back to 2024, even if it's received in 25. Any questions for me on the financials?
The opioid settlement, how many years out is that we continue to get that, those monies?
So 18.
18 years? Okay. I figured it was going to be a long term. I just don't remember how long, so
Yeah.
thanks.
And Ken was just providing me some information. Some of them paid like 5 years at a time. Other ones are paying it each year, so it's very random how that revenue will come to us. So we'll just keep track of it as we go.
Okay.
And I just think it's worth emphasizing on the healthcare campus, that revenue where we're 1.6 million ahead of where we were last year at this time. So we can definitely see the changes in the reimbursement rates there.
Looking good. Moving on to Kitty Roads Dementia Crisis Stabilization Unit update. Is that Shar? Thank you, Shar.
Is this on? Yeah, okay. Hi, I gave you the flyer for the open house. Fingers crossed that the weather cooperates. So we put a lot of time and effort into planning. So we're really hoping that it will pan out for us. So the open house is tomorrow, 5 to 7 at Kitty Roads. If you're going to be coming or anyone who's watching is coming, if you park in the main parking lot and enter the main doors, we will have somebody to escort you, show you where you need to go. So that's the best place to park because it's really the only place with parking. So let me just kind of do a recap of what is the Dementia Crisis Stabilization Unit. It is a 10-bed, 28-day max program, and it is the goal is to assist in connecting with the residents. And anyone who comes into the Dementia Care Crisis Stabilization Unit either has to have a diagnosis of a dementia or a suspected diagnosis of dementia. The goal being connecting with the resident, learning what their triggers are, exploring what are effective interventions, and then sharing that. So having that person leave with a plan of what is that. And so moving forward, assisting that person into living the most fulfilled life that they can. The 28 days comes from the state's definition of what a dementia crisis stabilization unit is. And that's probably one of the most frequently asked questions. So what happens if it's day 29? What I can tell you is we're still working on process and policies of what that looks like. Also fresh off the presses are the rack cards from Adam had printed. This will be what we hand out to folks looking to explore whether this is the right intervention or not. So people can come into the dementia unit in a couple different ways. One, it can be a voluntary placement, something where maybe a guardian signs somebody in. If maybe somebody has moved stages in, for lack of a better term, in their dementia, and they're now in a middle stage or in a late stage, which looks very different than previous. And so the interventions that the caretaker needs to learn about or learn how to utilize are going to be different. And so when they come in, we'll give them an opportunity to, like I said, we'll take some time, learn the triggers, learn about the person, how we can best connect and get them the best plan of care leaving out the door. The other would be emergency protective placement, and this is actually the most attractive piece for counties. I was just on a meeting about 2 hours ago, and they're like, when can we send them there? We have to have a provider, so a psychiatric or a psychologist who is willing to do that initial examining physician's report. And so working on that still, we don't have a contract solidified, but I am very hopeful that we have a provider who's willing to provide that. It has to be very timely, it has to be within 72 hours, and they have to be willing to testify. So sometimes those are things that become barriers for, especially a psychiatrist who is very busy. They're very in demand. So kind of the timeline. So if you remember, this came in very quickly. So it came in July 1st, which was like 4th was in the middle of the week, and it was due in the end of July. So we had to throw this together very quickly. So I met with the team at Kitty Roads, or actually in Kitty Roads, but at the healthcare center, the supervisors and the APS worker supervisor, and just tried to brainstorm what do we need to get this up and running, because the grant was only for startup costs. So we had to be able to purchase things quickly and things that we needed. So our first We submitted our first application in the end of July, and we asked for $376,000. We were granted that and told, and by the way, there's some extra money. So if you want to go back to your team and see if there's anything else that you need, we were able to come up with about, we resubmitted for $600,000, and we were granted that. So we had that was September 1st. So we had from September 1st to February 28th to spend $600,000, which sounds easy, right? It's actually been a lot of work. So anything over the $5,000 needs at least 2 or 3 bids. So getting some of those things in place has been challenging, but we have had a team. Our facilities department has been amazing in working with us, and because a lot of this has fallen on them. The team at the healthcare center, when things come in, they're getting things unpacked and put in place. So tomorrow when you show up, it won't even look like there's been $285,000 worth of stuff delivered there, because there has been. Some of the things that we've done with this team is we've had multidisciplinary team meetings weekly since September, and just strategizing and planning. There's a work plan that we have to follow, and we've really worked through almost all of it at this time. We've been able to get all of the unit supplies, beds, mattresses, furniture, medical supplies, wheelchairs, walkers, lifts. Probably the coolest thing is some of the dementia-friendly calming devices that we have. I hope they're set up tomorrow. There's a light, I can't think of what the name brand, it starts with an S, Snoozle or something like that. And it's light, it's sound, it's touch, and it goes to all the senses, and it actually is found to be very effective with dementia. Things like dishwasher, washer, dryer. Over the years, they pilfered some of the things when the unit was open. They needed beds and stuff like that. So we had to replace all of those. We were able to get IT equipment, copiers. We'll be doing the music and memory programming. So we have like the iPads with where you can put down a specific playlist for that specific person, and working with the family and finding out what works best. So we'll have that available. One of the really probably most valuable thing we've been able to do is provide training, not just for the people, all the staff that will be working on the unit, but anyone at the healthcare campus that may have any connection or working within the unit. So the facilities department was offered, the kitchen, anyone who might be interacting with anyone on that unit, our crisis team, our corporation council, and our APS team all have been trained into 40-hour training that I can tell you takes about 60 hours to do, but it's really good. Recruitment and advertising, we've been able to work with Adam on a ton of that. He has been very active on social media, on trying to do some of the just recruiting, because if we don't have enough staff, we can't open it. We're really, really close. We need about three more staff, which is so much closer than 13, right? So we're really, really doing well. We were able to purchase a van, which is a big deal, because the more we can keep law enforcement out of this programming, the better for everybody, the better for law enforcement and better for the client. So the things that we're continuing to work on, policy, process, and paperwork. Actually, Sandy is working on it currently, so hopefully we'll be done very, very quickly. Next week, a meeting with Corporation Council really does solidify our contracts and our MOUs and what are they going to look like. And like I said, we still need 3 more staff. So really excited. This has been a whirlwind of a grant. There has been incredible teamwork across all departments in getting this going, and a ton of support, not just from our community, but from the communities surrounding us. Because sometimes some of the smaller counties, their clients are sitting, their patients, our residents are sitting in emergency rooms because there is no place for them to go. So this is going to be such a valuable resource when we get it up and running. What questions do you have?
Thank you. What an amazing job you and your team have done. So just wanted to acknowledge that.
Thank you.
Quick question, sure. So just wrapping my mind around it. So you've got a diagnosed dementia patient, they get 28 days to get stabilized, and then the plan is to send them back to their living environment?
That's a great question, and that's probably another very frequently asked. So there's one other dementia crisis stabilization unit in the state, and one of their criteria is you are discharge planning at intake. So if I'm making a referral, I need to know what the next step is, because we're just stabilizing and then we're going to get to the next step. It's going to be a challenge, no doubt.
Kind of like a long-term ER type of setup, or...
And we have the nursing home that has, we have Orchard View. So if we need longer-term care, we have it right there. So once they stabilize, and if they don't have another place, and we have the ability, we could just move them to the within our own system.
Thank you. Anything else?
I just want to say how exciting it is to hear about this. I worked in our nursing homes for a few years, and this, I know they need this as well. But the ability for patients to be stabilized, clients to be stabilized, and return to their living environment, if that's home, that's amazing.
Right.
If it's back to a facility where they can continue to live their best life, it's just phenomenal work. So thank you.
Thank you. I should have said with the training, one of the cool things about the training too is has a family component. So you can actually just give the family the link and they can, as a family, they can do it individually, but they have 4 modules talking about, what does this mean, as an initial diagnosis, and what does this mean as a progressive diagnosis? So.
Thanks, Shar.
Yep.
Sorry, one more.
Sorry, one more. Okay, so the intake part it's 28 days. Is it up to 28 days?
Yep.
Like if things are perfect, they can be gone in
Yes.
2 weeks?
Yes.
Okay.
So it's really about the stabilization and really coming up with that plan. Like because we want them to leave with something. So yeah. Yep, up to 28. And our funding, so the funding sources would be Medicaid, right? Medicare and contracts. Yes, no?
No,
Okay, thank you. I'm so glad she's here. That's why she's here. I need her.
it's really just self-pay or contracts. So, whether it's other counties through an emergency protective placement, family care. So the Medicaid portion would be family care if they're placing someone, or self-pay. But straight like card services, fee-for-services from Medicaid, no, is not an option for that.
Thank you. All right, thank you.
Thank you. All right, next order of business is Director's Report. Bob?
Thank you, Mr. Chair. I want to note, too, that Shar really took the lead on getting this startup grant, which was a lot of work, as she pointed out. Her other full-time job is as behavioral health administrator, so she's pulling from 2 roles here to get this kind of effort going, which is a tremendous amount of work while managing the behavioral health division. So she really deserves a lot of credit for this, along with Sandy and her team, of course. But I always want to point that out when I have the chance to. Coming to the end of the year here, so I like to do a report just to give you an update on certain aspects of our department. And this year I thought I would point out some of the new staffing positions that we have, some of the new positions in HHS that resulted from the 2025 budget process, funded in a variety of ways through grants and opioid settlement dollars and other funding sources like Medicaid and some tax levy. Before I get into the positions, I was pointing out at the very beginning of your report some of the challenges that we anticipate going into 2025, probably in 2026 too, so I'll just copy and paste it next year. But the primary cost drivers for us are the emergency placements for adults in places like Winnebago, and the out-of-home placement costs for kids that go to residential treatment facilities. And these cost drivers, as I spelled out here, some of those costs that are associated with those placements, we're mandated to cover these costs primarily. We get some reimbursement for the Winnebago placements if we can bill their third-party insurance, but otherwise we end up paying for these placements. And those cost drivers tend to also dictate which legislative priorities we see as important when we go to the legislature, so we can talk about what these kinds of costs are doing to our budget. So I pointed that out at the beginning here just to kind of, as we get into the report a little bit, you'll see that we have our legislative priorities that we feel are important listed in here, and a lot of them tie in with these costs, and that's what we're trying to impact when we talk with our lawmakers. Starting though with new positions, I just wanted to point out what some of them are. We have 2 new positions in the ADRC, a resource specialist and a disability benefits specialist that were approved in the budget, and some small FTE increases that were also approved in in the budget for the ADRC supervisor, just making her position full-time. Excuse me. Public health nutritionist and the public health program support specialist. We're seeing a pretty dramatic increase in WIC cases, women, infants, and children, in public health, and both of these positions will assist with WIC. We have a youth justice case manager that was approved through referendum last spring and had been housed in the Justice Support Services Department. But after talking with Phil Golly and Ken, decided that that position would best fit under our Children's Services Division. And we moved that position to our department. Again, it's funded through referendum. It had been a ARPA-funded position, and ARPA funding ended, and now the referendum will allow us to continue funding that going forward. But this position will be housed in Children's Services and deal a lot in the area of truancy with the area schools. Our 2 mental health co-responders were also funded through referendum last spring, so those positions will continue in partnering with law enforcement. Sorry. And then we have a substance use disorder professional position that is funded through opioid settlement dollars. That position will be housed in behavioral health as a behavioral health position, but embedded in our Children's Services Division. That position is intended to work with families involved with CPS who have substance use issues of some kind, and that's about 70-75% of the families involved with CPS who have substance use concerns of some kind, or maybe the primary reason why they're involved with CPS. I'll talk as long as I can. Yeah, well, yeah. But again, we're trying to implement positions, new positions that will hopefully have an impact on those out-of-home placements and benefit families involved with CPS so that they have better outcomes, at least in this case related to their substance use, and helping them get treatment and support and helping the family stay together. A couple of other positions I listed here are grant related, so they're grant funded. One is in Adult Protective Services through a grant there, through the Office of Violence Against Women, and the other is the State Opioid Response Grant. We did get the SOR grant, the State Opioid Response Grant for this year, but the award amount was much less than what we had anticipated. They had a lot of applications this year, which reduced the overall grant awards for places like us. So this position I believe is safe, but we're having to rethink sort of how we're going to budget this money that we did get. It was about how much? About a quarter of what we'd hoped for. $152,000 a year for 3 years. Pardon? No. Anyway, so those are some of the new positions that we will see in 2025. I also put in here our strategic directives for our strategic plan 2023 through 2026, and just listed some progress that we made under each of those directives. One of the things we're currently working on is an HHS intranet site. It'll be similar to the Bridge, which is an intranet site for St. Croix County employees, but this will be more specific to Health and Human Services and create a centralized place where HHS employees can find policies and documents and information that's specific to our department more easily, have that readily available, and then we'll link to the broader intranet site for the for other things available through the Bridge. I list, you can read what I put under each directive, so I don't go through it. And then the last thing I wanted to update you on was the status of ARPA positions, or ARPA initiatives. If I can make it. At the November County Board meeting, there was $100,000 of additional ARPA funding that was to be used for community partners at the county administrator's discretion. And I had a discussion with Ken about what I thought might be good agencies to use this money towards, and Administrator Witt agreed that a majority of the money is going to Turning Point and to Grace Place on the Salvation Army, $40,000 each in 2025. $10,000 will go to continue supporting Recovering Together cafes, which were started under ARPA funding. They've been very successful, working with families with young children who have an interest in recovery from mental health, addiction, or other trauma, other things like that. And those are free to the public, and they provide child care and free meals to people that come to those. And the other $10,000 is going to be dedicated to our neighbor's place, who serves homeless individuals and families. Recovery Support Solutions was our withdrawal management project that we started with Western Wisconsin Health. The ARPA funding will end. Our ARPA funding will end as of the end of this year, but Western Wisconsin Health has decided to continue that program beyond the life of ARPA funding, which is, I think, a really great benefit to the public. So there will be medication-assisted treatment and all of the things that went along with that effort continued through Western Wisconsin Health. Mental health co-responders were ARPA funded. Now they're funded through the referendum. Peer support specialists are included in the 2025 budget for one more year of funding through ARPA. We contract with Northwest Passage for peer recovery specialists, who are people with lived experience who work with people with mental health and or addiction kinds of issues. Our community-based case managers were, I think, a valuable upstream initiative that we started, but that funding has ended already for community-based case managers. We had a hard time with retention, and when the last person left that position, we just decided not to fill it. And the last thing is rental assistance for recovery housing. We provide rental assistance for first month's rent. We partner with Onyx House, Lighthouse, and Berkwood for that. And that rental assistance will also come to an end at the end of 2024. Although that's been a very, I think, very beneficial use of that money. And then the last thing I'll just mention are the legislative priorities that we identified within our department. We have a legislative advocacy committee that we started as a part of our strategic plan. And under that legislative advocacy committee, we selected 5 priority policy papers that we thought were the top 5 out of the list on the WCA legislative paper that they put out. One is to establish psychiatric residential treatment facilities, which are they're a specific model of care for young adults, people under the age of 21 with severe mental health, addiction, trauma-related needs. This model would be a Medicaid-funded service if the state gets them up and going. So it would help not just with capacity within the state to place kids in a facility like this, but to also receive reimbursement, which we don't currently get. So, you've got examples of the white papers that we drafted for each of these in your packet, so you can read a little more about each of them. But I'm just reading off the headings for each. But one is to fully fund Aging and Disability Resource Centers, which are, have continued to be underfunded. I don't think we've seen an increase in funding for ADRC since 2006. And the other is to provide full state Medicaid funding for crisis services and community support programs, which is also in these are all in the WCA agenda, but we spelled out more detail of those in the white papers that I've included in your packet. Preserve public health authorities. Public health in Wisconsin is, I would say, drastically underfunded. It leaves us vulnerable if we don't protect the authorities that we need in order to respond to disasters, communicable disease, environmental threats, other kinds of public health needs. And the last thing was to regularly increase funding for state aid programs, just our general reimbursements from the state or support from the state. I'm going to stop talking now, but happy to answer questions you might have.
Thank you, Bob. Any other questions? Moving on to future agenda items. Is there any requests for future agenda items? Seeing none. Announcements. No announcements. Date of our next meeting is January 15th. And wish you guys Merry Christmas, Happy New Year's, Happy Holidays, and we are adjourned.